In this video, we will be showing a technique of a complete extensor mechanism reconstruction using a fresh-sized matched complete extensor mechanism allograft. The authors have no relevant disclosures. A midline incision is used and extended 2 cm proximal to the quad tendon and 2 cm distal to the tibial tubercle. Skin flaps are elevated both medially and laterally. A complete patellectomy is then performed, and the native patella tendon and quad tendon should be preserved as much as possible. Care should be taken to preserve the underlying trochlear cartilage. Debridement of any poor quality tissue along the quadriceps tendon, as well as a lysis of adhesion, is performed in order to mobilize the quadriceps. Traction sutures are placed in the medial and lateral retinaculum of the quadriceps tendon. A continued lysis of adhesions is performed both superficially and deep to the quadriceps tendon. Full knee flexion was obtained following lysis of adhesions. Krakow fashion fiber wire sutures are placed along the medial and lateral edges of the native quadriceps tendon, with space preserved at the central aspect of the native quad tendon to allow for later incorporation of the allograft quadriceps tendon. A size-matched complete extensor mechanism allograft is measured for tibial tubercle osteotomy according to the length, width, and depth of the allograft tissue. Tibial tubercle osteotomy is performed according to the size of the allograft, with the TTO tapered distally. The tubercle is then press-fit into the osteotomy slot and fixed with one 4.5 mm and two 3.5 mm large fragment cortical screws. Position is reconfirmed with tension on the quad tendon under lateral fluoroscopic image. We reassess the patellar height of the operative extremity at 30 degrees of knee flexion with the allograft patella in place. The previously placed traction stitches in the native quad tendon can be used to restore adequate patellar height, with the goal to match the contralateral CDI. The allograft quadriceps tendon is then sutured with a fiber loop. A pulver taft weaved of the allograft quadriceps tendon through the native quadriceps tendon is performed. The allograft tendon is tenodiced back onto itself and native quad tendon with braided sutures. Additional number 5 fiber wire sutures are placed in the medial and lateral retinaculum and then secured to any remaining quadriceps allograft and tissue surrounding the patella allograft. 4 number 5 fiber wire sutures are brought down in a crisscross fashion over the allograft patellar tendon. 2 swivel lock anchors, 1 lateral and 1 medial to the tibial tubercle slot are drilled. The fiber wire sutures from the medial and lateral retinaculum are placed into the respective swivel lock anchors. Any gaps between the retinaculum and allograft tissue are filled with number 5 fiber wire sutures. Ovicral sutures are used to tack down the sutures overlying the tendon. Construct stability is assessed with knee flexion and extension, with knee hyperextension and 45 degrees of flexion being achieved without any undue stress on the construct. Patellar height can be confirmed with intraoperative fluoroscopy. The tourniquet was then deflated and wounds were copiously irrigated. Subcutaneous tissues and skin are closed in standard fashion. The operative extremity is then placed in a hinged knee brace and locked in full extension.